Hello everyone, now we are here back at the Beauty Triangle Festival and I am currently in the Injectable suite with Galderma, joined by the wonderful Dr. Zoya. Now Dr. Zoya, could you tell us what you've been doing here today in the Injectable suite?
So we have been back to back with consultations. Patients from all over the country have come in to see us. And what's really been interesting is how the mindset of patients have changed. People don't come in anymore and saying, can you treat this wrinkle? I want to get rid of this line. They come in saying, what's going on with my skin? How can I improve its quality? And that's where the focus is. And that's where the future of aesthetic medicine is going. It's regeneration. It's getting your skin cells to wake up and start replacing and producing what it's losing naturally with the aging process. So we're no longer going in and just filling or masking problems. We're treating the underlying diagnosis and the cause at the root.
It's really interesting that we're taking this more holistic approach to aesthetics. We're thinking about quality, we're thinking about the root cause, something that we're seeing overall in the aesthetic and wellness industry, but actually now we're taking that into injectables as well. You've mentioned their skin boosters. Can you explain why skin boosters such as Restylane are so important right now?
Because we lose a lot of things as we age, okay? We speak a lot about collagen and elastin, but we don't talk enough about the natural moisturizing factors, the ceramides, the hyaluronic acid. That also decreases because the factories shut everything down. And what skin boosters do, they help to replace the hydration at a more superficial level. So I always say to my patients, your skin has multiple layers like a cake. So the icing layer is where the Restylane skin boosters really excel because they go in and repair a lot of the damage and a lot of the inflammation and the loss of hydration at the most superficial epidermal level.
It's really interesting. So where do things like Sculptra come in, the bioregenerators?
Perfect. So if we use that same analogy of a cake with different layers, it's the deeper layer. It's the dermis, what I would call the sponge layer. So the main scaffolding, the sponge of that cake is where Sculptra goes in. So if the skin boosters are replacing the hydration and doing damage control at a more superficial level, Sculptra is doing that at the sponge layer. So it's replacing the collagen and elastin, which is why you get improvement in your bounce back, tightness, firmness, and because you're replacing the springs in that mattress with the collagen, you get natural volume replacement as well. But you also get some improvement with your fat cells. So it's like 3 layers.
I love that cake analogy. It really brings it to life. It actually makes us think of our skin really differently. Exactly. And with that, where does skincare come in? Because you've been speaking here today about Alastin. When's that important to bring into the
back to the icing layer, yeah. So if skin boosters are hydrating from within and improving some inflammation from within, the skincare is maintaining. So I always say to patients, you wouldn't go and see a dentist twice a year and then not brush your teeth or floss in between. So that's where Alastin comes in because it maintains and boosts the results in between seeing your injector.
And do you think that people are more willing to do that now? Do you think that we're understanding that actually it's the homework, it's the things that we're doing at home that are so important to uphold the results that we're seeing in clinic?
Exactly that. The injectable portfolio has expanded massively. Sculptra is the OG, it's been there for a long time, but people haven't really understood why it's necessary. So now that patients have more of an understanding, that's why we see Sculptra flying so high. So it's not just a little bit of neuromodulators or a little bit of filler or quick fixes. It is actually going in on cellular regenerative levels to give longer lasting results and repair what was getting damaged.
It's interesting you say this idea of knowledge. We've all got so much more knowledge. Like you say, people are coming in and asking for these things. They understand them. So they want to know the long-term results as well. Zoya, thank you so much. That was absolutely wonderful. That was a fantastic overview of everything that you've been doing here in the Injectable suite.
Thank you.
I will leave you to get back on with your consultations.
Thank you.
We will speak shortly.
Thank you. Bye.
Thanks, everyone.